Welcome to this session on the policy pillar of the Capture the Fracture Partnership. The aim of the partnership is to reach out to key stakeholders and drive policy change in fracture prevention to prioritize bone health and post-fracture care through coordinator-based programs such as the Fracture Liaison Service. Our objectives include identification of key stakeholders and communication with them, the supporting of osteoporosis as a national priority, and the endorsement of policy change by stakeholders to develop a strategic plan. The outcomes of this particular pillar within the partnership are to induce national policy change to increase quality standards for patients, encourage national funding and coverage for post-fracture care, understand the patient pathway, improve the quality of existing PFC programs and fracture liaison services, as well as the number and engagement in these by policymakers. Key actions in driving fracture prevention will be the organization of roundtables and workshops with key stakeholders, advocacy for public and private sector mandating of PFC program reimbursement, and the incorporation of stakeholders to effectively drive policy change and secure its execution. The Principal Resource Syllabus is a generic policy document entitled Capture the Fracture Partnership Guidance for Policy Shaping, an executive one-page summary, and a series of country-specific documents. The generic document includes a call to action, which maps out the increasing proportion of people aged 60 years and over around the world, documents the 13.5 million fragility fractures and 500 million individuals suffering from osteoporosis estimated globally by 2025. It then maps out a case for change, characterizing the rising cost of fragility fractures and expressing the disability-adjusted life years of various non-communicable disorders against the estimated reduction in severity and cost by intervention over a 2-year period. And you can see that the Fracture Liaison Service optimizes the estimated reduction in DALYs compared with the DALYs currently spent when compared with breast cancer and dementia. The 4 building blocks of the policy document are catching fractures early, treating fractures well, preventing across the life course, and enhancing engagement. The country-specific documents will then illustrate that solutions exist, build responses, document benefits, and identify gaps in provision. An overarching infographic takes us through the number of adults with a broken bone each year, the current status and the expected benefits of a post-fracture care service, the computation of the number of fractures saved over a 5-year period, and ultimately the economic consequences of this strategic modification. They will be supplemented by a benefits calculator, which is an online tool whereby the costs associated with FLS services are estimated, the outcomes of these services are calculated, and the national cost-benefit balance is determined. This budget impact calculator will estimate the 2-year and 5-year overall refracture rate, admission, operation, bed day and care home burden, averted costs, and fracture liaison service costs. The benefit and budget impact calculator will also relate current care costs to PFC care in terms of new fractures, avoided fractures, and impact on hospital care and overall cost. Finally, the impact calculator will inform the other components of the partnership, the coalitions, mentorship, scalability, and fracture liaison service database components of this overall 5-pillar partnership. Come and join us in the Capture the Fracture partnership. Help us to influence policy and thereby to reduce the burden of osteoporotic fracture worldwide with the instatement of optimized post-fracture care. Thank you very much.